Hi everyone, we're on the trail guide number 2, Dr. Hefferon, Dr. Rovig here. We are still on the pelvis and hip, so we're going to look at the iliac avenue. If your patient is in standing, one of the easiest ways to go about it is you're going to put flat hands on the side of their hips, come up, and as you drop down in off of their soft tissue, you should really feel the iliac crest. We talked about that the spine of the, not the spine, sorry, that the iliac crest rotates anteriorly and also goes posteriorly. We're going to follow that down. So one of the easiest ways when I'm trying to figure out my landmarks as far as my patient goes is I'll slide in and on top of that iliac crest. Make sure that you have a little bit of indentation so that you really feel that. With your thumbs, you're going to slide down. You'll actually slide down the spine, so that anterior inferior spine. And as you do that, if you can come up and underneath your patient, you're going to feel that those are the ASIS. So if Dr. Rovig kind of rotates a little bit, if I'm on the side, I'm going to start here. I'm going to rotate down. As I come over the ridge of the pelvis, if I come up and underneath, that's truly your ASIS at that point. From that point, if you want to really roll into the PSIS, another important landmark of the pelvis, you're going to have your patient turn around. You would be usually front on, but for the sake of the angle, I'm going to show you from behind. I would start from the same spot, kind of start with your iliac crest so that you have your landmark. As you drop down, you're going to drop down with your thumbs, and you're going to palpate. What's interesting, and you'll notice on Dr. Rovig, is I can actually palpate deeper into the left PSIS than I can on the right. Also saw when I was palpating her ASIS that she has some asymmetry with that. Very important to notice when you're with your patient those symmetries within the pelvis, because that can be a big part of if someone has some SIJ dysfunction, so sacroiliac joint dysfunction, or if they actually have lumbar pain. Those two can go hand in hand on that. Another reason we might look at that is anything below in that kinetic chain might be off because of what's going on with the pelvis as well.